You put food on a table, this twin's going to eat differently than that twin. Even though the same food is on the table, I don't like icky broccoli. Oh, I love broccoli, you know, kind of stuff. And so they affect how their genes will react based on what they're eating or not eating. Now, the first 91 days of pregnancy, everything is formed. The embryo, the human embryo, the animal embryo, is moving along an assembly line, kind of like the Ford cars. And if the guy who's supposed to be putting on the, the fuel pump into the engine, you know, has to go to the bathroom, he goes to take a pee, he goes back in the back and he doesn't stop the line, doesn't say, hey, come fill in for me while I'm doing that. He might come out and 15 cars have gone by then. So at the end of the line, there's 15 cars without a fuel pump. Because one of the pieces was missing during that time, right? Well, the same thing is happening to human babies. After the first 91 days, when the baby's forming, everything else is just growth. By 91 days, you got what you got. There ain't going back. There are some exceptions, but not many. Now, Sarah Palin, whether you liked her politics or not, she was a sexually active woman who is over 45 years of age, very high risk of having a Down syndrome baby. Now, her OBGYN should be put in jail forever. Because he should have said to her, you know, Sarah, you're going to be out on the road out there eating hotel food and rubber chickens and all this kind of stuff. You'll be taking some serious vitamins and minerals because at your age, you're still cycling, you're sexually active, you better be taking the 90 essential nutrients. You better be taking all known essential nutrients, otherwise you're at a high risk to have a baby with Down syndrome. The OBGYN never said that. Never offered her any advice. And so, guess what happened to Sarah Palin? She had a baby born with Down syndrome. That OBGYN should go to jail. Then that would never happen again. But there's no consequences. Even for the governor of Alaska, even for the vice presidential candidate of the United States, her doctor screwed up that bad, and he didn't lose his license, didn't have his license suspended for 3 seconds, wasn't fined as much as a traffic ticket. There's no consequence. And this will happen over and over and over and over. Oh, just what bad luck? No. It's bad or lack of advice. You wouldn't tolerate that kind of service from anybody else, from any other industry. In the old days, they'd be burned at the stake. The doctor would have been burned at the stake in the old days. A couple more and then we'll get back on the track here, but these are too much fun. Oh, here's the ones I've been looking for. The human brain, as it's forming, this is at 3 weeks of age, and this is when homosexuality occurs at that 3-week to 4-week level in here, when the hypothalamus is forming. And as the brain is going down the assembly line to get to this at 6 months of age, it requires a lot of stuff. I'm one of the guys that sued the FDA over folic acid. Without me suing them, back in the 90s, they still wouldn't have folic acid and prenatal vitamins. There would still be a high risk of spina bifida. I'm one of the guys that sued them for that. Okay? And so I'm very familiar with this kind of stuff. Cerebral palsy, totally preventable. This is an underdevelopment of the cerebellum, the part of the brain that deals with the fine motor movement. And you'll notice that people with cerebral palsy is kind of a spectrum. You get them that are barely affected, and it takes a professional neurologist to tell you that they got cerebral palsy. I mean, they might just kind of walk funny, and you think, God, that kid's already dancing. But they already have some early stage of cerebral palsy. Now, when a child is born, a normal baby, 6, 7, 8 pounds, their cerebellum is part of the brain that affects fine motor movement. It should be the size of a small tangerine. When they have cerebral palsy, that cerebellum could be the size of a plum, which is like 30% smaller. They're going to have cerebral palsy. Or they could be the size of a walnut, which is 60% smaller. They're going to have this type of cerebral palsy. Oh, he's got cerebral palsy kind of thing. And then you get this 11-year-old girl who has catastrophic cerebral palsy. The only thing she can move is her eyes. It costs $1 million a month to care for her. Between all the physical therapy and the speech therapy and this therapy and feeding tubes and enemas because she can't have a bowel movement, all this stuff. Plus, you know, a $100,000 machine so she can kind of, with one finger, move herself around, run over the chickens because she can't steer it very good and all that kind of stuff. This is because The mother was missing just a few pennies worth of stuff before pregnancy. Somebody needs to go to jail here. This just goes on and on and on and on. Now, her cerebellum, you can actually look, the CAT scan, the size of a pea. Her mother had severe deficiencies for longer periods of time, so that piece went down through that 91 days and never got enough to develop. And again, for those of you who don't know the anatomy, there's a cerebellum right here. Okay? This is this piece here. That's the piece that doesn't develop when you have cerebral palsy. Varying degrees of severity. This is one of my favorite slides. Everybody knows about belly button hernias. This kid's born with one the size of a walnut. You give him a hypnotic, not enough to put him under general anesthesia, but just enough to make him kind of drug-induced intoxication. You give him some local anesthesia, and in 10 minutes' time, this is easily dealt with. But here's another belly button hernia. This one, probably mama was missing some zinc for a week as the embryo goes from a disc into a tube, and this piece didn't get zippered up during development. Well, here's one. These two, next two, were on the autopsy table. These are, I'm a pathologist, so I see crazy stuff like this. This one, there was no skin over the belly button hernia, and the stomach and the spleen and some of the intestines were hanging out. And of course, it cost that child his life. It was a perfect baby, nothing wrong with that baby except a little belly button hernia. And the muscles incarcerated that circulation and all that stuff, and the baby dies of circulatory shock during the birth process. And here's one that's really wild. Same thing on the autopsy table. Here, the liver, the stomach, the spleen, all the intestines are out. That's a catastrophic belly button hernia. Totally avoidable. The OB/GYN didn't have his license suspended for 3 seconds. Didn't have to pay a parking ticket. Got to walk. Now, if a mechanic scratches your car while he's rotating the tires, you sue him. Oh, this was just an act of God. No, it wasn't. It was a failure of the system. Same way here. You can find a good Christian doctor who would volunteer his time to sew up these kids. You can go to the Save the Children fund and get the $250 each for the anesthesia and the suture material. But all of this is totally preventable. Rich women, poor women, middle-class women all have babies with cleft palate and cleft lip. It's a simple nutritional deficiency in the embryo when it's closing up as a tube. How many of you have heard of babies being born deaf, congenital deafness? Very common. It's a deficiency of a single mineral, manganese. I don't know, there must be 200 studies on this back in the 50s and 60s. We know for a fact, as predictable as gravity, you can prevent congenital deafness and certain types of things that would look like cerebral palsy, called congenital ataxia, because the semicircular canals in the ears are all damaged from a lack of one mineral, manganese. Not magnesium, but manganese. There's a lot of prenatal vitamins that don't have manganese in them. Well, here's what the medical system is looking for. They're looking to decode the genes. There's 100 papers that show very clearly that this is caused by a manganese deficiency in the first few weeks of pregnancy. They're looking for the gene. Why? Because that's where the bucks are at.